Dr. Chapman, drinking on campuses, that's been going on for quite a while, hasn't it?
Well, since we had the formation of William and Mary back in the 17th century, yes, indeed. But what's different nowadays, oftentimes, is the way in which students tend to look at drinking. So we have a long history of alcohol being sort of associated with what college students do. But it's only in the last 20 or 30 years that we've begun to see some rather significant changes as far as the frequency or the way in which college students have tended to use alcohol. You know, we hear an awful lot about binge drinking, and the impression that a lot of individuals get is that A, all college students are drinking, and B, when they drink to get drunk. But the truth of the matter is that most college students are rather moderate in their consumption, and the kinds of information regarding collegiate drinking that we hear about most frequently tend to be about 22–23% of the students. And while that is a large population of students who are engaging in high-risk drinking behavior, it certainly is not all students. And interestingly, the same research that tells us that we have somewhere in the neighborhood of about 22 or 23% who are engaging in rather high-risk behavior with alcohol also tells us that we've got about 20% of students nationwide who choose not to drink at all. So interestingly, roughly the same number of students who choose to drink and do so in a risky fashion, we have the same number who are engaging in self-imposed abstinence, if you will. And whether that's because of cultural reasons, because they're in recovery, they just don't like the taste of it, whatever, about a fifth of our students, pardon the pun there, fifth of our students choose not to drink. Gary, you bring up a number of interesting points, not the least of which is every generation has a tendency to look at the generation that follows it as being sort of out of control. And I can remember my dad having a conversation with me about what are you thinking about, Robert? You know, as he would take you looking at some of my thoughts, be they political or social or whatever. But the point that you bring up, I think, is a really interesting one as far as what's going on as far as the expectations. And one of the things I had mentioned earlier in the program is the fact that the way in which alcohol was used by college students in previous generations seems to be quite different than it is being used today. For example, when I was an undergraduate student, which was in the late 60s, the individuals would drink, and yes, we would on occasion become intoxicated, but this was almost more accidental rather than intentional. Whereas we find individuals today in that hardcore drinking minority that I had talked about before, that 22–23% of college students, may actually choose to drink with the intent of becoming intoxicated. So whether they, for example, when was the last time you saw a beer commercial or a liquor commercial where it wasn't the sunniest day, it wasn't the best looking men and women in the nicest clothes and the shiniest cars? When was the last time you saw an advertisement that showed somebody who was experiencing the consequences of alcohol use that individuals who engage in high-risk behaviors will experience? And when you look back to the way alcohol, as a matter of fact, you couldn't even see liquor advertising on television back when I was in college or when I was a lot younger, whereas we have liquor advertising today. So I think that there are many factors, and I'm not suggesting that the advertising media are primary purveyors of some of the high-risk kinds of behaviors. But if you just stop and take a look at the next billboard, the next advertisement in a magazine, the next television program or what have you, you're going to find that you probably are seeing things that are in the background, if you will, of that advertisement that are suggesting that some of this high-risk behavior is behavior that individuals should engage in or that most people are engaging in. Thank you. It was a tale of two cities. It was the best of times and it was the worst of times. And we've talked a little bit about the worst of times, but what's the best of times is we've got a lot of scientific evidence that suggests that there are strategies and approaches that work, that there are ways that we can address alcohol use on our college campuses in such a way as to bring about changes in the way students understand alcohol as a substance and drinking as a behavior. And when we see environmental management strategies or other kinds of approaches that are being used by oftentimes by counseling type individuals on campus, when a student gets into difficulty or violates a university policy, that person would be sent for a screening and an assessment. And there are particular ways to do screening and assessment that increase the likelihood that students will change their behavior in as little as 2 interviews. And this is coming out of work that's been done at the University of Washington under the leadership of Alan Marlott, who's a rather well-known researcher in the area. And the approach is called BASICS, or Brief Alcohol Screening and Intervention for College Students. And in as little as 2 interviews, students will reevaluate their whole approach to using alcohol. And in my own work, I've come up with strategies and approaches that I've used with students that translate into significant changes. And again, it is engaging students in conversations that allow them to sort of look at the facts in a relatively different manner.
This is
Well, if anyone is interested in reading those monographs that you referred to earlier, they can be read on or downloaded from my website, which is Robert Chapman, RobertChapman, one word, .net. And also there's a link from my primary webpage to a collection of essays I've written, many of which deal with the issue of higher education, collegiate drinking, things of this nature.
Center, Dr. Robert Chapman, we want to personally thank you again for coming into the studios, giving us just a wealth of information.
You're welcome.
And your colleague here who's making a documentary in here in the studio here. Again, I'm your host, Rick Ford, with my co-host, Fred Barber. Fred, your final words, Fred.
Finally, I'd like to just say one thing that is helpful as we talk about the problem. Talk therapy works.